do a demonstration for us. It's also important to state that I'm aware that the best presenter or the best team will receive some substantial amount of money to implement. All right, that sum may or may not be announced before the end of this meeting. So please stay glued, stay connected. All right, the agenda of this meeting will go in this format. First, we're having the welcome and opening remarks now. Just to say, today is not a day for many speech. We're not going to have a lot of speeches. We'll just go straight to the showcase, and then we can have our speech in the next event. Up next, we'll have an overview of the showcase format and the judging criteria. Then we'll have the pod presenters. It's important to state again, I think the pod presenters have been told before now that they have 15 minutes divided into three quartets. 5 minutes for to pitch, then another 5 minutes for their demo, another 5 minutes to take questions from the judges. Keeping to time is also one of the judging criteria. I will give you that as since you came early, let me give you that as a small insight. All right. So while you are speaking, also know that the way you manage your time will also be evaluated. All right. And then we have the final remarks from our judges, and we'll close with some announcements. All right. So for this showcase today, we have 4 judges. One, we have Mr. Udoka Gibre. Oyeboloise is an innovation and sustainability consultant. We have Ms. Emanuela Ezike, she's a global health and development consultant. And we have Anne Freitas, a data scientist and AI expert. Also joining anonymously is an independent judge whose name I cannot disclose. All right, and then other observers, one, we have Ms. Ifechi Covenant and Ms. Praise God Omoroge. All right, so judges have been briefed and I'm giving exactly what to do for this. So please, for our pods, I hope you are here. I hope you are active, you are present, because we are going straight into it. And the order of presentation will be the order in which you sent in your reports. So Agri pod will go first, and then the environment and climate pod will go next. Health pod will go next. Okay. Okay. Ifichi, okay. Can you revise what you sent again, Ifichi, please check.
Okay, so the ports have numbers attached to them to show, so there is health pod 3, there is health pod 1, agri pod 1
Oh,
and 2.
okay. So we have multiple pods for the same focus area. Okay, so we have agri pod 1 will go first, and then the environment and climate pod 2 will go next. Head pod 3 will go next. Head pod 1 will go next, agri pod 2 and SME pod 2. Let me take that again. So the first group is agri pod 1. The second presenters, environment and climate pod 2. The third presenters, head pod 3. The fourth presenters, head pod 1, I beg your pardon. Agri pod 2 is the fifth presenter, and then SME pod 2 is the sixth presenter. All right, this is exactly the order in which you submitted your deck. All right, so please, we'll just receive Ifechi quickly to give us some ground rules for this event as we proceed. Ifechi, please.
Okay, thank you very much, Favor. So without wasting much of our time, I think everybody here, we already do know the mode that the presentation is going to go. The teams have been informed. You were given some kind of instructions on what to do and what not to do. So once you're called upon, please do ensure to stick to time and try to be as audible and as concise as possible. And I just want to say well done to each and every one of us. It's been, because I'm most parts, and it's been really, really, amazing seeing the work that we've been doing, seeing how we've been trying to, carry everybody along and to ensure that everybody who was part of the project actually did contribute. So it was really, really beautiful to see. So well done, right? Well done to each and every one of us, and just do take whatever the outcome of this in good faith. Just know that we see you, we see the effort that you did put into your work, and your work is amazing. So well done to everyone. I would hand the mic back to Favor to proceed so we don't waste a lot of time.
All right, thank you so much. So we're going straight into it. Agripod, please confirm you are here and you're ready for us.
Okay, yeah, we're here. We're ready.
All right, so you have 15 minutes, which is shared 5 minutes for your presentation, another 5 minutes for you to do a demonstration, and then another 5 minutes to take questions from the judges. I can see already from the participant that the judges are here, so don't worry about them, they're already judging. So I'm going to set the time for 15 minutes. I have a timer here for 15 minutes. So you can start.
I'm sorry.
Go
Sorry,
ahead.
just before we begin. Yeah, sorry, just before we begin. I just want audio confirmation from the judges. Doka, do you want to say hi? Emanuela, do you want to say hi? And do you want to say hi so that they get to meet you? Yes, it will be great.
Hi, everyone. Can you hear me?
Yes, we can. Thank you.
All right. Good evening, everyone. My name is Emanuela, as mentioned by Favor. I'm glad to be here. Looking forward to the presentation from the teams. I've heard that a lot of work has gone into this, and I've read some of the briefs. I'm really impressed with what has come out so far. So again, excited and looking forward to hearing your solutions and the impacts they would have. Thank you very much.
Thank you. Thank you very much, Manuel. Are you here? Hi, Luca. Can you hear me?
Yeah, sure. Okay.
Do you want to say hi?
Yeah, sure.
Sorry.
Good evening, everyone. Can you hear me? This is Udoka Gabriel Onyabolise, and it's exciting to be here to see most of the amazing solutions, and I'm looking forward to the presentation and the demos, and really to learn more about these solutions that have come up from the past 8 weeks. Thank you.
All right. Thank you very much. Hi, Anne. You want to say hello?
Hi, hello. My name is Anne Freitas, and then actually I've been working crazily with almost all the reports, and then I feel like it's finally over, and then it's crazy that we've been able to do a lot of stuff, but at the same time, kudos to everyone. You guys are doing amazingly well. You guys are learning super fast, and I can't wait to see who aces it at the end of today. Thank you.
Thank you. Thank you very much. And okay, Favor, you can go ahead.
All right. Agripod, over to you.
Okay. Good evening, everyone. This is Pod 1 Agriculture. My name is Awal Mohammed Sani. Today, I am presenting AgriSage to you. AgriSage is an AI-powered tool that helps Nigerian smallholder farmers farms and make better decisions. I myself and my partner Febo, who is the team lead, work together to build this project. And after my short pitch, Febo will take a live demo. According to International Fund for Agricultural Development 2020, 90% of Nigeria's food depends mainly on smallholder farmers. And these smallholder farmers depend mainly on rainfall. And nowadays, rainfall is inconsistent due to weather shocks and climate variability. Our users are small farmers in Nigeria, many rear animals, and also grow crops. Their main problem is not laziness. It is not knowing the best choice before they spend. But what they don't know is, will I make money or lose money? So it is hard for them because prices change at any time, rent can fall at any time, and input keep getting more expensive. This is a big concern in Nigeria because small farmers produce most of the food and they mainly depend on rainfall. This is the problem AgriSage is built to solve. So let's see how the solution can fit into the problem. When a user comes on board, AgriSearch check the farm details of the farmer already knows, like farm size, number of animals, how long the season is, and the cost. And then it shows a clear results within seconds of how much money they can make, how much they will spend, and the profit, and also the risks that is in that activity. So we understand that making plan is not enough, so farmers must follow it. So AgriSearch helps them to do that. It saves every plan so they can come back later and compare what they did before. It also gives reminders with real dates so they don't forget important things like harvest time and animal cycle days. With the tracker, farmers can see what plan work better and learn how to get more profit with less risk. We also understand that planning is one step, but on the farm, many things get changed. So AgriSearch has an AI advisor that gives help in four main Nigerian localized language, which is English, Igbo, Yoruba, and Hausa. And it helps in two types, which is fast help for quick response and deep help for complex questions. Farmers can also send voice notes and upload pictures so we can help with the real problems. This is so important because there are not enough extension workers. So many farmers need easy and steady support on our site. Our impact is very simple. Farmers can make better choices and follow up their plans. First, AgriSage helps farmers see profit and risks before spending it, and they avoid mistakes that causes loss. We also want everyone to access it. That is why if a farmer has no internet, a trained personnel can help them create a plan and give them the printouts or in form of SMS. And reminders can also come in form of SMS. Later, we will add WhatsApp and USSD code so even simple phones can use it. In the pilot case, we will track three results: how many farmers finish their plans, how many steps they do on time, and how close real solutions are to the plan. So in conclusion, farmers work hard, but they need clear choices. AgriSearch shows profit and risks before they spend and help them follow the plan, set plan, and remainder sections. We already have a working product and 15 testers in Lagos and Kano states. Next, we want a pilot in Lagos and Kano state for 6 to 8 weeks and 60 to 80 farmers. What we need is very simple: a financial support to run the pilot, and then pilot partners, ways to reach the farmers, and mentorship or data support. Thank you for listening. And now Fabo will take a tour on a short live demo. Thank you.
Okay, I'm Favo Isafo, and I'm the team lead for agricultural pod 1, and I'm going to be presenting the demo of what my partner said so far. So let me share my screen. So So I believe everyone is in my screen. So here I need to.
You may want to stop sharing while you are logging in.
Oh,
And
so
one of the judges, they're asking for you to send your GitHub link.
okay, I will do that. I will do that after this this demo, or should I do that before the demo?
They'll answer
Please
in
do
the
it.
chat already.
Please do it before the demo. I need to go
So
through the
do
codes.
do that now, please.
Okay. Oh, so I should send it. I should send my the code to my website, right?
You can just send it to me, Favor. I'll send it to Anne as soon as possible.
Okay. So I hope I'm not wasting time, or if I'm doing that right now. So
If you could pause the timer so you could send the link, that would be great. And so pause the timer at 4 minutes. They had about 4 minutes to do the demonstrations.
So
Yes,
other pods, please start sending your links now, so we don't have to go through this again. I'm seeing a message from the judge, HeatCast. Please do the same. So everybody just send whatever you have to send now on your link to Ifechi. She'll forward it to the judges. Please let's do that for other pods, because we'll not give you the time when you are presenting to do that to count as part of your time. Please do that now. Thank you.
Thank you, Favor. Your GitHub specifically so we can see your code, please. Thank you.
okay, I've sent the files already.
Send them to Ifechi on WhatsApp, please.
Yeah, I've done that already.
I'm speaking to other
Okay.
pod teams. Please send your link or whatever you have to send to Ifechi. Thank you. Eva, are you ready?
Yeah, sure. So this is AgriSage. This is a tool for smallholder farmers. It turns a few farm input into a profit estimate and a risk level before spending. So for this demo, I'll be showing 3 practical crop plans. And from there, we move to the tracker, alert, and advisor, which help farmers follow through. Now in this section, I already created 2 plans earlier to save time. A tomato plant that is intentionally for high groups and a viscous plan that is low risk. And now I'm going to create a new plan. just to show a practical demonstration. So I'm going to create a new plan on maize. So I'll just use the default numbers there just to save time. And here we have the summary. So AgriSage brings out a summary of what the farmers have imputed in the crop planner section, bringing out the revenue to cost and profit and the risk. And farmers can also use what if scenarios to ask questions like, what if irrigating part of the field, changing fertilizer rates or different selling price? They can ask what if scenarios. I don't want to go into this just so we don't waste time. So I need to show the most important part of this this project. So the farmer goes to the farm tracker to compare crops. So I'm going to compare the new plan I've created and the previous plan that I created earlier before now, just to compare crops. Here we can see tomato shows high risk because it's rain-fed and more sensitive, right? Hibiscus is low risk, and maize is the new plan showing the medium risk. You can see it here. So we can see maize is showing the medium risk, and this is how farmers avoid a season-ending decision by comparing crops or comparing their plants together to know which is giving much ROI and lesser risk, and the ones that are giving higher risk. Then move to the plant history and harvest alert. This is where this section is the follow-through layer. Every plan is saved with a timeline, so farmers can visit decisions across cycles. You can see the start date of every saved plan. This plan is the previous plan that was created before now, but wow, this is the new plan that was created. You can see the start date, today's date, and the harvested date. When the milestone approach, the farmer gets reminders to their email. They get notified when the harvested date has reached, so they can go and harvest their plant. For this section, we go to ask the advisor. First, I will use the instance mode, fast rule-based, to support with hard guardrails tied to it, so it doesn't mislead the farmers. It doesn't tell the farmers the wrong thing to do. So that's why I implemented hard guardrails or RAG into this, so it doesn't mislead the farmers. So I'm going to start with using the rule-based answer style, and I'll switch this to maize since my latest crop plan is maize. So I'm going to use the latest plan only. And I'm going to ask a question, just a simple question. That is based my latest plan.
That's when you hear that sound, it means your time is up. I'm sorry. So we'll move now to questions from the judges.
But just to confirm, did we restart the timing at 4 minutes, or it started at 2 minutes 38 seconds?
It started at 4 minutes.
Okay, thank you.
All right, judges, questions for pod one, agri pod one.
Thank you very much, AgriSage. This is really beautiful and practical. I think it's a much needed solution for farmers. I just want to get clarity. I know part of when you were making your presentation and from, I would say, the summary of your project and all, I think you made mention of WhatsApp platform and USSD or something. Yeah, so, but the demo you showed now, it didn't seem to apply that. How would farmers access the platform, for instance? Is it web-based? Is it a mobile app? And what kind of farmers are you trying to target with your solution?
So maybe all the judges should ask, then they can respond. Annie and Emanuela.
I will go last because I'm just going through the codes right now.
Also, we're giving all our questions before they respond.
Mm-hmm.
Okay, thank you. Sorry, I missed that. Thank you so much, AgriPod One, AgriSage. Amazing product, amazing efforts. I think to my question, I think that's also drawing from Gabriel's question is what was our consideration with literacy level and mobile phone access, especially for women. We know that women also make up a majority of farmers. Some of them might not have access to mobile phones or use their husband's phones. So what was the consideration first for literacy level? And then how have you considered gender within your solution? Lastly, I'd want to ask what is the source of the data that you're using for your predictions? And I think my last question is why would a farmer who has, some of them have over 20, 25 years of experience in this practice, why would they?
Can anybody hear Miss Emanuela?
I think our network disappeared.
Okay, so please,
Sorry, I didn't hear anything.
AgriPod, go ahead and answer the questions that has been asked already.
I have some questions too, if that's okay. I do not have on the live application. Based on the message I received was that it's a local host, which is fair and okay. But I think by now, since we had like up to last week, a whole full week to work on it would have been deployed, which is another limitation. That's for me because I could not go scan through the 2 minutes to know whether your app actually works for me. Number two, if we're looking at real world situation, I really pinpointed something. You used Kano State in the first risk assessment lab. Is it risk or something like that? You used Kano State, and I was just looking at it before you scroll through quickly. You used local government and you put optional. And being someone that has been from Kano State all my life, I'm curious because something you could plant in Kumboto, it's not always 100% same you could plant in another different local government because of the topography and all of that. At the same time, I'm curious, what is the real world situation of this thing? The second one, I noticed you used RAG, which is basically mostly in this situation. It doesn't really tell the situation based on RAG. I don't know. It doesn't really tell the situations, the real world situation based on RAG. And number three, okay, after this whole application, were you able to test it? What were you trying to give us as the story behind this whole situation or this whole system? It's not just about what you've coded, what you've done. What is the real world situation? Okay, if you're telling us you have a person who is supposed to farm Zobo is going to prepare for 1.2 million. What is the real world situation? The market price, what is it as at now that we're going to prepare in the next 2 to 3 months for? That's my questions.
All right, AgriSage, before you respond, so let's put a little modality to this, right? So I'll give you another 2 minutes to respond to this question, just because this announcement I'm going to make now, I did not make it initially. So after your 5 minutes of presentation, 5 minutes of demonstration, for the 5 minutes of question and answers, please, each judge has 1 minute to articulate their question each together, and then the presenter has the other 2 minutes to respond, because we have 6 pods presented today, and that's the schedule designed for this meeting. All right, so I'm sorry this ground rule was not set before now, set correctly. Please let's take note of that. So for that, I will assume just spend 3 minutes asking the questions and give them their 2 minutes to respond to them. And I can only hope that they've articulated or jotted down these questions. Also, before we proceed, very important announcement. Everybody, if you are from a pod, please rename your profile and add your pod in bracket. Also, if you know your profile is having HP or iPhone, in the next 5 minutes, if it's not renamed with something we can relate with, all right, you'll be kicked out from this meeting. So if in the next 5 minutes your name is still HP or iPhone, we'll have to kick you out from this meeting. All right, HP, I think HP is the person talking. Rename yourself now, because in the next 5 minutes, if your name is still HP or iPhone, you'll be kicked out. All right, you're encouraged to also turn on your video when you are presenting. I hope this ground rule are clear enough. So I'll just hang on. I will restart your time for 2 minutes and then you begin. So please, let's take notes going forward. All right. Then go ahead, please. Pod 1, respond to the questions from the judges. Your time is counting.
Okay, thank you for this wonderful question. I think the first question was on what platform do we deploy the project? Is it application platform or web platform? Yes, for now it is on localhost web platform. Yes, and then another question that's our data source. So our main data source is FAO stats. FAO stats, yes. And then we also get our data from Geopaths. And then we also get our data from we also get our data from Geopath and FAO stats. So, and then the literacy level, this project is addressing like 3 levels of literacy. We understand that there are farmers that they cannot read or write. That is why we introduced the voice notes in the advisory section. Yes, and it can you can input the data via voice notes through your localized language, whether you are speaking Igbo or you are speaking Hausa.
All right, thank you. Thank you very much. I believe the judges have gotten enough to give you a fair assessment. All right, we're moving to the next pod. So I'll just go over the rules again. It's important to stick to them. First, for the presenter or for the pod, you have 10 minutes, split 5 minutes each, 5 minutes for your presentation, 5 minutes for your demonstration, but I'll give you the full 10 minutes. So however you want to manage it, you can do your presentation in 2 minutes, that's good for you. And then you have 8 minutes to do your demonstration, but you have a block 10 minutes. After that, you have another 5 minutes. After that, you have another 5 minutes for question and answer. For the judges, please, you have 1 minute, just watch the timer. You have 1 minute to articulate your question, and then 1 minute each for the 3 of you. And the 4th judge, if they have a question, they can reach out to Ifechi, they can ask their questions. And after that, the presenter gets to have 2 minutes to respond. Please, let's be mindful of time. It's important so we can stick to our plan. Also, the sound you hear at the end of your time is to prompt you. Once you hear the sound, I don't need to cut you off. That's just a modest way of letting you know that your time is up. So you're supposed to stop immediately you hear the sound, so I don't have to interrupt you. All the same, thank you very much, and well done, AgriSage. Best of luck. All right, so the next pod now, and I hope they've sent their links and everything to the judges. It's environment and climate pod 2. All right, your time starts now.
Please, before I start, let me know if you can hear me.
Yes, we can hear you. Yes,
Okay,
you are.
thank you. Yes, let me know.
Sorry to interrupt you, Richard. Before, why did we not applaud AgriSage? Do you think it's easy to present, guys, to be the first to go? Please, can we just react to AgriSage, guys? I don't know what you guys are doing. Like, I know that your presenter and your moderator for today is a very, very strict moderator. So, well done, guys. Great job. It's not easy. If it's easy, build something. Now, let's see. All right, over to you, Richard.
Okay. Let me know if you all can see my screen. Please, can you confirm if you can see my screen?
Yes, I can see your screen. Go ahead.
Okay, so good afternoon from my side to all of you, and I trust you are all doing great. My name is Richard Gamatei, and I'm here presenting for Climate Pod 2, and we are here to present to you our solution for HeatCast. So I want to ask, and I know probably that most of you here might have weather apps, and sometimes you might receive notifications on your weather that maybe the coming days there is going to be rain, and probably sometimes it does rain. But then we tend to forget. We tend not probably mostly we don't really consider temperature, like what's the temperature going to be next week. Of course, because of the fact that temperature affects us a lot. You are working, even you are working, and then you are in the sun, and then because of that high temperature, you are sweating profusely and all of those things. Now, we tend not to even consider those things, but it's really, really important because in 2024 alone, temperature reached about 44.8 degrees Celsius in Sokoto, which is something that is very, very important for us to look at. Because one outdoor workers like the pure water seller that is there, that is selling the pure water in the sun, can experience heat burn. Even the pure water will get hot. When you buy it, you'll be drinking hot water. Now, health workers are also, health facilities even become strained because of the fact that people suffer from heat burns, and they suffer from heat-related diseases, and then they bring it to the hospitals. And it also affects crop yields. Why? Because when the sun scorches, when the heat affects the crops, what happens is that the crop yield goes down, and then food security becomes a challenge. And also, from 1999 to 2021, there had been 131% increase in deaths that are related to heat. And this is really something that it needs to be looked at. We also tend and we also understood from our data, this is our data, that currently in northwest Nigeria, especially in Sokoto, there have been 30 days in only 2024, 33 days, sorry, in 2024, that there was heat wave. And about one of them lasted for 9 days. And all this evidence that I gave you is important for us to understand, because it leads to these temperatures, this data that I gave you, I gave out, is because it's important for us to understand, because heat wave exposes Nigerians, not only Nigerians, but everyone, into heat diseases. And this is something that needs to be looked at critically. The solutions that we have presently are generic. Some of them don't even don't take into consideration the weather data in that particular area. And then most of them too also will give you reactive responses, because they don't even give you a warning. The heat problem, you get the heat disease before you even start treating it. And this is why we developed HeatCast. HeatCast is a platform that provides analysis of weather data that is related to heat. And we make it so that it is localized, and then it also has simple interactive dashboards that you can make use of. You input your own data, but it works by you inputting your own data. Analysis are run for you, and then you can take insights from that. And then we also provide you with actionable recommendations that you can follow. So the platform has capabilities like heat risk index, where you can, with clear analysis and visualizations, where you'll be able to know when there's going to be a heat, when there's going to be a heat wave. We also have predictive models that you can use to forecast the heat, that is probably how many in 7 days, in 14 days, or in 30 days, whether there's going to be a HeatCast in the coming days. Then we also provide you with like visual analytics and then actionable tips that you can follow. So let's go into the live demo where we demonstrate what HeatCast can do. So when you come to HeatCast, the first that you are going to do is that you'll be greeted with this information about what the app is about. Then when you click on Climate Insights, you provided an opportunity to be able to upload your own data. The reason why we do this is because first we were interested in Northwest Nigeria, but we understood that this can also be made available to everybody. So that is the reason why we made it available for you to be able to upload your own weather data. And then these are the columns that we expect to be in your data. So we have the analysis section, we have the forecast section, and then we have the heat risk section. So let's start with the analysis section. Here, you'll be able to carry out analysis on single variables, multiple variables. For instance, you can come here and then carry out monthly heat intensity across the number of years that you have in your data. For instance, this data, you can see that April has the highest, or the red ones indicates highest. Then there is also heat risk analysis, which provides you with where months that there were heat, how many the years, and then this dashboard is also interactive. You can hover over it, and then it gives you some insight. We also provided observations, what we observed, and then the implications of those things, and then we also give you some necessary recommendations that you can follow. Then when you come to the forecast section, what happens here is that at the forecast section, you can select your own model that you want to use for the forecasting. For instance, you can select Prophet, or you can select LSTM or XGBoost. Then you can also select the number of the horizon that it has to be, but the number of days you want to forecast for. For now, you can forecast for 7 days, for 14 days, or for 30 days. Then the target variable, do you want to forecast average temperature, or you want to forecast heat index? So let's say we want to forecast maximum temperature. When you run this, it is going to take some time because it's now carrying out the forecasting. Then we provide you with an interactive dashboard for you to be able to see your forecast, the history data, and then what your forecasted trend. Then we also give you what is observed from your forecast. Then we also tell you that if we give you this information that 0% exceeded the threshold. What is the threshold? The threshold is 40 degrees. So if you look, if the threshold is, if you forecast that it's above 40 degrees, it means that there's going to be heat wave in coming days. Then we also give you the opportunity to be able to download this forecasted data and then use it for further analysis. This could be done, policymakers can take this, researchers can also make use of this. Then we also have what we call the heat wave risk and dashboard, which provides history of all heat waves that occurred in your data. Then it also gives you a 7-day forecast of probability of a probable heat wave in the coming days for 7 days. And you can see that the value is just 0 here. So it means that there's not going to be heat wave in the coming days. We give you what is observed, and then we also give you some recommendations. This data that we've provided for you here from your own data that we've analyzed, you can download it, and you can also download the risk from here. You can make use of it. So these are the capabilities of HeatCast. Now I would like to go back to my slide again, and so I want us to understand that heat waves is a reality. This is caused by climate change. It is not, and sometimes not very easy for us. It's not, we won't be able to probably do away with it, but we need to be prepared. And then HeatCast is something that can help us to be able to do that. Now, one thing that we envisage about this is that, one, we are expecting to be able to expand this, even though we allow you to upload your own data, but the analysis that we did, or the tips and then the recommendations that we gave, were mostly related to Northwest Nigeria. We also envisage embedding real-time satellites and then IoT sensors into the data to be able to get real-time data. Then we also envisage deploying this by adding a mobile push alerts for farmers, for people, for everyone in the community to be able to receive heat alerts at any given point in time. So this is what our heatwave is about, HeatCast is about, sorry. And thank you all so much. And we are ready for your questions.
John, is your question?
All right, thank you so much, Richard. I will just jump in here. Amazing, amazing. I'm actually very impressed with this particular idea. I think you can even pilot in Abuja because it would be great for us to forecast the weather because it fluctuates very crazily. But I have two major questions. The first is, who really is your primary audience for this system? And two, for the uploading of the data set, some of your parameters don't seem to be locally accessible. So have you given considerations to how whoever it is, your primary user is, would access this data to be able to upload it to your system to generate the insights that you have shared? Thank you.
Mr.
Can I
Gabriel,
answer that? Or
hold on, Mr. Gabriel, any questions?
I think those questions highlighted and mentioned are really my concern, the target audience, and yeah, who is it for? Then yeah, I really want to get who the use case is for, especially when you're looking at the demo. Who are you targeting, and what would they use that information for specifically? It wasn't clearly communicated.
All right, thank you. Miss Anne, any questions?
Hello, Richard. I think your presentation was stellar, perfect timing, engaging. Your slide is great. I could literally feel the connection from the slide even before you got to your demo. But then I was very curious when you were predicting. I don't know. You guys will have to pardon me because I'm very keen on prediction and data. You predicted using a Sokoto data. What if in a situation where they do not have access to the baseline data? Do you provide it for them, or do they have to keep on uploading every time? That's my first question. The second question, during prediction, I noticed your prediction in Sokoto, mostly the heat wave is mostly from March to around June, August. But then in your prediction, during your confusion matrix, it was basically at March, April, and May, which is, to me, I find it very kind of, and at the same time, if I'm looking for heat wave, I think I should be able to tell from your prediction. Why stopping at April? Why not extend it down to this? So I feel like the data you got is incorrect or something somewhere, but I think it needs to be worked on. Apart from working on the other things you've said, I think the data needs to be worked on, or look for a better data that could tell the story.
All right, thank you. Mr. Richard, you can respond now.
okay, thank you so much for those questions. They're really amazing. And so the first question, if I could remember correctly, is who is our HeatCast? Who is it for? So one, we developed HeatCast for policymakers. That is the first people. That is because they need to be able to have insight into what is going to happen, so that they can tell people they will be able to help people understand what is going to happen in the coming days. And then apart from that, everybody who has access to a mobile phone, or even a system that can access a web application, can be able to access it and then get their data and then upload it. And then so policymakers and even researchers also can do that. Then the next one is sorry, I think I've missed the second question that was asked. I don't know if that is, I don't know if it can be repeated again. The second question that Miss Emanuela asked.
It can be asked, it can be repeated, but all within your time.
Okay. Yeah. So then, okay, if you can repeat the question again, please. I think the second question about promising users or something.
Yeah, so I said for the uploads, you have the place where you have people upload a CSV file or an
Yeah.
Excel.
Okay. Yeah. Thank you so much about
Yeah.
that. For that, we made them aware of the columns that we expect from them. So I think that is what we made there. So if you look at the what's the name? The that pattern that is there. Sorry, I'm missing it out. There is a way for you to be able to look at the column names that the data is expected that we expect for you to add. Then about the data source, this one we are making the users to be able to upload their own data, and you could upload. Okay, yeah. So that is it. Thank you.
Thank you very much. Like we did with the first presenter, please let's appreciate. What's the name of your pod? Environment and Climate Pod. So please a round of applause for them.
Richard, great job. Well done. I don't know why you turned on your video right now, but great job.
Round of applause.
I just have wait, question. Do you have team members or you're just by yourself? Your mic is muted.
Sorry. Yeah, my team members are here. I have Winner with me. I have King there with me. I also have Zubeida with me. I don't know if they are on the pod though, but
team members, can you just turn on your videos and do a shout out? I just want to take note of some things.
Winner. Yeah, Winner is somewhere there. She's here, and then
oh, I see. No wonder I see Excel
Climate
on the call.
too.
Oh,
yeah, we have Climate.
Now.
I should check Climate Pod too.
Okay, interesting.
Thank you.
All right, thank you very much. Up next, and thank you, Environment and Climate Pod. So I was going to mention this. Please, if you are going to use a slide, make sure it's on slideshow, right? So it's more clearer for us to follow. So next pod is head pod 3. All right. Over to you. Head pod 3.
Okay, hi, Mercy, and I think Joseph. Are you guys here? So I think Mercy messaged me that she's having some issues with her connection. I don't know. She said somebody threw her off the call. Mercy, can you speak now? Okay, so maybe we should move to Health Pod 1 while she tries to figure that out.
Okay, so I'll give Head Pod 1. I'll give you another 1 minute. All right. To put your things together. I assume you're probably waiting to come up after now. So you have 1 minute. Just make sure you are ready in the next 1 minute. Is this Head Pod 3?
Hi, Utiba, are you speaking?
Yes, I'm speaking. Good evening, everyone. I'm so sorry. I was trying to share my screen. Good evening, everyone. My name is Utibel Boots, and I'm part of Pod 3 Health for Q Easy. I want to start with a story that changed my life. I arrived at a federal hospital at 8 a.m. in a critical state with intralumen gas. By 5 p.m., about 9 hours later, I left without proper care and went to a private hospital. While we're preparing for this presentation, that she was going to be at the hospital the next day, and she knew she was going to be there by 7 a.m., but she was not aware of when she was going to be back. And I'm sure this is the reality check for many Nigerians on the call when you visit a public hospital. And that's why we built Q Easy. In Nigerian public hospitals, patients wait an average of 122.6 minutes, that's over 2 hours, as compared to just 44.9 minutes in nearby private facilities. Even more alarming, only 2.7% of patients are seen within the recommended 30 minutes of arrival. And here's the worst part: zero predictability. You're not even sure of when you're going to be seen. The WHO has warned that this level of overcrowding threatens patient safety and quality of care. Hence, QEasy. QEasy is a lightweight AI-powered queue management system built specifically for Nigerian hospitals. We have 3 core features: end-to-end digital triage registration, AI-powered wait time prediction, a live queue dashboard for hospital staff. Now let's talk about impact. Based on our pilot simulations and benchmarking against similar queue management systems deployed globally, QEasy can deliver 40% reduction in wait times. Patients get to be seen faster. Also, an 85% increase in patient satisfaction. Why? Because patients finally have visibility. And 60% boost in staff efficiency, where healthcare workers can focus on care and not chaos. And here's why. Now is the perfect time. Nigeria's digital health market is projected to reach over $1.5 billion by 2025, with a 15% annual growth rate, taking it to $3.3 billion by 2030. We have 22 federal medical centers and over 50 teaching hospitals serving 200 million people, 80% of whom have mobile phones. Here's what we're asking for. We're asking for $250,000 in seed funding to take QEasy from prototype to national development. Phase 1 for MVP development, which is 3 months. Phase 2 for FMC pilot program. And phase 3 for national scaling. Every Nigerian patient deserves to know when they will be seen. And also they deserve the tool. A healthcare worker deserves the tool to help them save lives, not just to manage paperwork. Thank you very much, as I would be showing us the app. So this is QEasy. Here, when the healthcare worker, when a patient walks into the hospital, the healthcare worker is to take their vitals. And so you have their information like demographics, so their age. I'll leave it at 45, or you can put it at any age based on the patient. So either male or female, that's their gender, their vital signs, which is their temperature, heart rate, and BP levels and the rest of it, and also the pain level, and also the clinical details, which includes if it is an internal medicine, if it is surgery, if it is pediatric, if it is a gynecology situation, and then danger signs as well. So for this point, I took age 32 male with the vital signs of 37 in temperature, heart rate of 75, pain point 3, primary complaint chest pain, and then triage level. So this has to be done by a healthcare worker and not by the patients themselves. And then after getting this, you also be able to get to see how many doctors are on shift, how many nurses, triage nurses as well, then service department, equipment and environment just for checks, and then working and the likes. Then you predict the wait time. Your prediction is complete, and you can check the result and info tab. So going to the result and info tab, you see that someone that has a triage level of 4 has 201 minutes of estimated wait time. Thank you so much.
All right, thank you very, very much. Still have 3 minutes, so it should be added to your time for questions and answer. All right, judges, please, over to your questions.
Okay, well done. This is amazing. It was clearly put. Your presentation was well articulated, and I think what's really stood out was your brand name. It's catchy and easy, like Q Easy, like really great. Um, but I would say this solution, right? Because you're trying to reduce, is it a queue in the hospital or healthcare centers? And the data is being entered by the healthcare personnel. So it means as a patient, I need to be at the hospital, right, to meet the healthcare person to enter my data. Like, I don't get how the practicality of the demo, like that scenario is not quite clear. I want to really get how that scenario works. If the patient, because I was assuming if it's preventing long queues in hospitals, the patients would have to enter their details or book something from their home, and they're able to get an appointment or a scheduled appointment. They know when to show up at the hospital. So when they show up at the hospital, they are getting attended to or something of that nature. But with what I see, the patient must be at the hospital to have their vitals taken by a healthcare practitioner. So just help me understand how that scenario looks like. Thank you.
All right, thank you very much, sir. So we were working
Hang on, please. Miss Manuela.
Hi, yes, thank you so much, Trevor. Thank you so much to the team for the presentation. I echo a lot of what Gabriel has mentioned. I think my own question is first, the feasibility of scaling to over 10,000 primary healthcare facilities in Nigeria. And then again, we know the estimated wait time is 201 minutes. This is more information for the patient. But how does that this get to the actual consultants, as the doctors, and how does that really decluster patients, doctor, that interface? I don't know if you understand. Is that yes, we've estimated the wait time, but that doesn't really make my treatment any faster because from your demo, maybe I missed that the information doesn't necessarily go to the doctors. So I think that's my major question. If I have the wait time, so what next? Does that really reduce my wait time or just gives me an idea of how long I should wait? And then the feasibility of scaling to primary healthcare facilities across Nigeria. Thank you.
Miss Anne, any questions?
Okay, this is great. This is nice. But then you took me out when you said $250K, and I was like, what? But then let's go. So to be honest, someone like me, I can fake pain. Let's not be let's not lie about it. I can say, okay, I'm in pain when in actual sense I'm not in pain. What about what has that patient bias got to do with everything you do? Have you factored into that? I could see on your screen you have confidence intervals between 100 and 403 minutes. That's a whopping sum of 300 minutes. That's almost 5 hours. That confidence is too shaky for me. The confidence interval is too shaky for me. If I'm going to wait 5 hours before or 5 hours after, I think I need to do something about it. And then the model you use, which is model R square, you did R square. So I want to ask, is it just one model you used, or it was a combination of various models to give you this percentage? Just my questions.
All right, thank you very much. So for this presentation, you have 3 minutes from your previous 10 minutes. All right, so that has been split between questions from the judges and then your response. So that takes your response time to 4 minutes. I think it's 2 minutes. 1 minute was added to the judges for their questions. All right, so let's go ahead with your response.
Okay, so I think Mercy wants to respond. Utibe, Mercy is your team leader. Do you think she wants to respond? Mercy, do you want to respond?
I would want to respond, but let her speak first. Then I will respond after, please.
Just keep an eye on your time, please.
All right, so the first question was to understand why the patient has to get to the hospital first to be attended to. So we were staging the specific scenario of the real scenario of a Nigerian hospital. Major Nigerians do not even know their vitals, especially when they are ill. And so most times they get to run to the hospital, especially when the situation is critical. So instead of us to put it on the patient, we decided to, okay, let them do everything at the hospital. And there's a part we didn't put out here yet, because that's going to be in the development stage, where you have the sign in. So the patient has their own interface, and this is just the interface of the hospital. So the hospital staffs, that's why we said this has to be done by a health worker. So they take their actual vitals. And it will also, which will also help to remove the fake part, of which that's what Ma Annie asked, that has to do with faking your symptoms. So we know that these are like real situations. So that was why we use that. And this estimated wait time is more like, okay, the hospital has seen. So for this, we saw that it's triage 4, level 4. That means it's not really critical. It's not really a critical situation. The pain level 2 was not so high. So that was why we left it at this. And we used model R2 to train this, just to test it. Like we said, we weren't able to get a real world data, a real world like hospital data. So these were like simulated, to show you in a simulated environment. Thank you.
All right. Good evening, everyone. First of all, I think there's a miscalculation in our timing. We stopped at 3 minutes. We're supposed to have 2 minutes for responding. And he started counting our time at 8 minutes. So we're supposed to have a total of 7 minutes before for our response. And if I want to quickly respond to the question, Utibe, please, could you go back to the app and show them? I think one of the questions was the 201 minutes is not really telling maybe a time management or so. So it depends on the critical condition of the patient. Just like we said, we have level 1, 2, 3, 4, and 5. So let's check on level 1, which is a critical condition for the patient. And just work on the data and click it up for them so that they could see. I think at that time, you will see that the minutes will be less than 200 and something. The 200 and something is because the patient came in with just maybe normal, there's no a critical situation, it's not an emergency. And since there is a queue of about 20 persons, let's adjust the queue to 10 persons and see. Then I'm emergency situation level 1, and then let's see the result. So that's basically, and then the app is not just working for the hospital, it's also working for the patient. Is a two-way thing. So from the house as a patient, you don't know your blood pressure at that moment. You don't know other vitals. So at the end of the day, you just impute the details you have and then get to the hospital. The other details that you cannot get from your house, they will impute it and then tell you, this is the waiting time for you to be able to see your doctor. I don't know if that answers the question. You can see now, this is, I don't know if she was able to edit all the vitals, but I guess this is level 1 for certain situations. And then it's now telling you, because of how critical your situation is, you have just 62 minutes to see the doctor because there are other patients that were there before you. But at the end of the day, we are saying that it's able to manage the time. You don't stay so long, depending on your situation and all of that. So thank you very much.
Okay, sorry, I was muted. I said your time started at 10 minutes, but for 2 minutes, nobody was talking and the time was counting. That's exactly what happened. All right, so thank you very much. Please a round of applause for them. Thank you, our judges. Thank you, everybody. So up next is our head pod 1. After that, agri pod 2, please get set. Put all your slides together. Make sure if you're having any issues, reach out to Ms. Ifechi now. If you're having any issues, so when we call you, we don't have to wait for you because your time will keep counting until you show up. All right, so head pod 1, over to you.
Okay, this is Chukuma speaking. I'm trying to share my screen for my presenters, so please just a few seconds. So I think my network is lagging from my end. Miss Ifechi, please, if you can help us share from your end, I think that would be much better to save our time, please.
Okay, let me try. What I have is a PDF. I'm going to share it the way I have because you didn't send a PowerPoint presentation. I hope it suffices. Okay. Go ahead. Can you see my screen? Hi, can you see my screen?
Yes.
Yes, I can see your screen. Thank you. Imagine a world where no woman is told it is normal when her body is actually asking for help. Let me take you to an era that still exists today, an era where pregnancy complications are detected too late, where warning signs are missed entirely, and where complications and outcomes depend more on timing than preventative care. Pregnancy complications rarely appear without warning, but in many low-resource settings, these warning signs are detected too late. We analyzed maternal health data from Tanzania, and we discovered that over 60% of pregnancies were already flagged as high risk as at the point they were detected. My name is Akibe Becky, and together with my team, HealthWard One, we built SafeMom AI to shift this timing from late to early detection. Now, the reality of most African clinics today still rely on writing their antenatal data on paper and storing them in files. And these files are only revisited during brief consultations with the patients. Many clinics already collect routine data such as blood pressure, blood glucose levels, so be it. But the problem here is not the absence of data. It is the absence of timely insights. Yes, these numbers are written down, but they are not turned into early warning that can trigger action. And as a result, risks are often recognized only after the mother starts experiencing complications. But SafeMom is here to address this problem because it converts routine antenatal data into real-time pregnancy risk scores. Using maternal health data from 8,000 plus women across Tanzanian districts, we trained an AI model to recognize early risk patterns, especially those linked to anemia and cardiovascular stress. So the SafeMom system is designed to work within existing realities. It works in two phases, the healthcare system phase and the mother phase. Now, the healthcare system phase involves a simple facility dashboard for health workers where they can view prioritized patients, while the mother phase involves a simple mobile interface where mothers receive feedback and referrals. When we tested the SafeMom model, it achieved an accuracy of 85 to 90% accuracy. And this level of early detection enables faster and more appropriate results. Now, instead of resulting or reacting to complications, now clinics can act on early signals. And instead of taking every case the same, they can prioritize the mothers who need urgent action using SafeMom. SafeMom is built for low-risk health systems. It uses data that is already collected from clinics. It runs this on simple digital tools, It runs it on simple digital tools, and it can be scaled across similar African settings. That is the beauty of SafeMom. It is adaptable and it can be scaled across similar African settings in the future. So ultimately, SafeMom turns delayed recognition into early warning and early warning into timely action. So when risk is seen, action can be taken on time. And when action is taken on time, more and more mothers can survive pregnancy and childbirth. This is the mission of SafeMom, because we believe that no mother lost to a risk we could have seen coming. I will leave the room for my second presenter, Serena, who will take you through the demo of the SafeMom idea. Thank you very much. Did I do well? Did I do well? Are you serious? Oh my God. She has not come.
Becky, we can hear you. Becky, we can hear you.
Becky, you did well.
That was
Yes,
so
we all
beautiful. I really love that moment. Thank you, Becky, for the unfiltered moments.
Good evening, everyone. So I'll just wait for my team lead, team lead Chukuma to share his screen so that I can do the demo.
Okay, I think I would have to do that. Please give me 1 minute. So, am I supposed to share the GitHub? Because I can't see, it's just the GitHub that was sent to me. Serena?
Kifechi, don't worry. Let me take it off from here. Thank you. So
Okay.
sorry. Please, can we see my screen?
Yes. Okay, you guys have the video.
Yeah.
Do you want to put it in full screen mode?
Okay, I'll do that, sir. Serena, can you see my screen? Please, you can go ahead now.
Okay, for the demo of today, SafeMom has 3 main functionalities. We have where the facility registers themselves, and then after, please, the video is not playing. Okay. For the demo of today's the SafeMom platform has the login area where facility comes, register themselves, and then they can have access to the platform. And the facility now has a dashboard that they'll be able to enter certain vital signs, as we can see. So you put in the patient name, the age, and the blood pressure. We divided into systolic and diastolic, the hemoglobin level, temperature, pulse, and weight. The weight and height is there to calculate the BMI, which was used for prediction. So after the prediction, for this patient, we have a 7% risk, and then it highlights whether there are some key factors. Maybe the patient has a low hemoglobin level or not. So for this presentation, we did 3 use cases. You can continue. And after inputting, we have a database that has that patient record stored. So each time you enter the patient information and do a prediction, it's stored in a database. We have a second portfolio where there's a 75% risk prediction. And we did, as I said, we did for 3 different portfolios. And each time the record, when the vital signs are inputted, we have it stored in the database.
Thank you very much. Thank you.
Yeah.
Let's go to the judges
Yeah.
for questions now.
Okay.
Judges, your questions.
Hi, can you hear me?
Yes, we can hear you.
Okay, thank you so much, Safe Mom team. Amazing job. I'm a bit biased to maternal health. So I think my first question is why Tanzania? I think your brief showed Nigeria, and I believe your presentation said Tanzania. So why Tanzania as your pilot country? That's the first one. I know that this is hospital facing. I really would have loved to see the patient facing bit of it. So I don't know if that's something you can still demo, or that's something you can walk through. That would be very helpful for me. Thank you.
Okay, thank you. Can I answer now?
Hold on, please. Mr. Gabriel, any questions?
Well done, Safe Moms. I don't have any questions for Safe Mom.
Thank you. Miss Anne, any question?
Good job, SafeMoms. This is great. This is it's insane, it's crazy because I've worked on something similar like this. But at the same time, I'm going to ask some questions. You did well, you did well. Don't think about what I'm saying so far. But then if you're looking at have you looked at the clinical relevance of this 99% high risks and all of that? That's my first question. The second question, I like the fact that you divided systole and diastole, which is a crazy situation that some people do. They don't even divide it, they just put it like that. I love the fact. But apart from BP, hemoglobin, temperature, and pulse, I feel like there are other components of the woman's health that makes her at risk during pregnancy, apart from this here. And then things like diabetes and all of that, I think they should be included here. These are situations that makes the why is it not here? Because those are the key main things: BP, diabetes, age, BMI, and all of that. Why are they not here? Those are the main important things.
All right,
Okay,
you can
I
respond
think
now.
I will give the first question for Becky to respond quickly, then I'll work on the last one. Becky, if you're there, over to you.
Okay, thank you so much, Serena. Thank you for the question. And yes, why we use data from Tanzania. Ultimately, the goal of the Gen Data program is that we bring solutions to solve African-driven problems. So we use data from Tanzania because it's offered high-quality data that we needed in such short time because it covered most of our project idea. We actually ran a survey in a clinic with pregnant women and health workers, but that data was not sufficient enough to test the validity of SafeMom. So we use this data to test SafeMom's validity. And the beauty of SafeMom is that we plan in future with appropriate investment to scale it across other African settings, like because Nigeria also faces this maternal health crisis. It is a proven fact. So we plan to also scale and adapt it to other African settings. So the use of Tanzanian data was for that reason. Thank you so much.
Okay, for the second question, the different percentages, they come about as a result of just certain functionalities that we put in place. And this is one of the challenges that we face, and with proper guidance and proper research, we want to see how to better explain this and to better represent the risk level. And why these features? So SafeMom is a work in progress. As Becky explained, we have other end goals for SafeMom, but these features was just to see the prediction rates, giving these particular features in a low resource setting where maybe you cannot have some certain features, then this may work. But we plan on integrating other features using the data set that we have and to make the platform better. Thank you.
All right, thank you so much. Please, a round of applause. A round of applause. A round of applause. Thank you so much. So the next pod, the fifth pod, so we have two to go. Agric pod 2, your next. SME pod 2, please get ready. Agric pod 2, over to you.
I'm trying. Hello, everybody. I'm trying to share my screen. Sure. Can you all see my screen?
Not yet.
Can you see it now?
We can actually see your screen. We can see your screen.
All right. Let me just start my presentation. Take you all the way to the beginning. Right. What? Okay, are you seeing this? Oh my God, my time is gone. Let me just take this away. Okay, hi everybody. Good evening, and my name is Mariamadi Burega, and I am representing AgricPod 2, and we'll be talking about a product called weather.io. It's a weather prediction and crop advisory tool. Other members of my group are Daniela, Hassan, Paul, Adenike, and Prince. And our mentor was Anne Freitas. So, why is it not going? Agriculture in Africa is a dirty gamble. The reason why this is because for something that is so important, we put a whole lot of, we leave everything to chance, right? You know, you're putting this amount of money, you know the exact amount of inputs, you know the amount of acres of land, but honestly speaking, you don't know if what you put in is what you get out. I think everybody can really relate to this because everybody knows Hassan, right? Or a lot of people actually know Hassan. Hassan is a member of my group, and this was his farm. He cultivated about 5 hectares of land for cucumber last year, and due to heat stress, he lost everything. And he said he lost over $2,000. And we also, why is he not moving? Close. We also spoke to like other people. One of my friends said, this is investing in agriculture is like the worst investment he has ever done, because you know, you just put in your money and then the next thing they'll be like, there is a flood, there is heat stroke, there's whatever just happens. And really nobody's like taking, you can't blame anybody for this. So according to FAO, this is FAO 2025, about $3 million is lost only in Kebbi. I did that in Naira. That is 4.2 trillion Naira in Kebbi alone. Only in Kebbi in 2025 was lost because of the flooding, like climate change issues. Now imagine for the others. And because of the consequences of this is that there's 400% rise in food price in just 1 decade. Everybody knows that food is expensive in Nigeria now. Like the amount of money the amount of percentage that you spend in as your income goes, a lot of it goes to food. The same thing goes to our imports. Now imagine, it's crazy to imagine that things are not going well in your country, and the only thing we could do is like bump up our import budget. Like, it doesn't really make any sense. It has other devastating results as I've listed on the screen here. I will not bother you with it. And our solution is weather.io. It's a very lightweight cloud-based machine learning plus AI-powered crop advisory and climate prediction tool. What it does is that it takes in weather data from EU Copernicus, and then it runs a prediction on it. And the people that we we solely believe, based on our research, that will benefit from it are farmers, agribusiness owners, people who want to invest in agriculture, and policymakers. So our major focus was actually Makwa, right? Makwa is a very small community in Niger State, and last year, this is just a total of the things that happened just in June last year, right? But in Makwa last year, something really devastating happened. In May 2025, there was a flood, and not only did it claim lives, not only did it claim lands, it actually claimed lives too. A lot of people were displaced, and the government did not have a choice but to allocate budgets to taking care of them. You see, climate change for agriculture does not just have one devastating consequence. It affects everybody. The government now, you have to take out money from where the resource is already thin, and you have to take care of people who you should have done something about it before. And my team actually went on to analyze what exactly is happening in Makwa. So we saw that there has been, while temperature has always been high in Makwa, we can see, and it's a seasonal something. There is a very interesting story that it tells us here for rainfall. Rainfall has been fluctuating over the years, right? But in the recent years, these red points are extreme events happening in Makwa. So there have been a lot of extreme events happening in the recent years than in the past. So 4 minutes, imagine. We have this model that we ran. We sampled a number of models, and these are the ones that we actually settled with. For temperature, we are settling with Auto ETS, and for rainfall, we are settling with Sarima. And these are the metrics. If we have any question, I think I'll just come back to you then. These are the expected impact. These are all the SDG parts that this project touches, and I'll just take you straight to the demo. Right. I have already selected Makwa directly on the screen so that we don't have to start searching for it on the map. And I will just try to see. I'm a farmer, right? I'm role playing right now. I'm a farmer, and I want to know if in the next 6 months, it is okay for me to plant cassava in Makwa. And then I run my prediction. So I wait a little. Okay. Right, our prediction are in. So in this, it just displays everything. The average rainfall that we're expecting in the next 6 months is 30.2, and the average temperature is 30.6. So it gives a recommendation here, and that is what is super interesting. It says that given the predicted high temperature and all of this, so it says that cassava cultivation is high risk under this condition for Makwa, not for everywhere in Nigeria. And he said the recommended supplemental irrigation and mulching is to retain so it just gives general advice on what to do, and use drought tolerant cassava varieties if planting is unavoidable. So that is weather.io. Thank you. I'm done.
All right, thank you so much. We still have 2 minutes, so we'll take this over to question and answer. All right, George, over to you. Questions.
All right, thank you very much. AgriPod 2. Again, the name is catchy and good, weather.io. The problem it's solving is very critical and very important. I know precision farming definitely gives great yield and potential, and that's a great direction now for, I would say, the world kind of advanced in it. Nigeria, we're still, working our way around precision farming, but I know it's a tool that would be very, helpful for farmers. General feedback to all of the presentations, including weather.io. The presentations are amazing. The problem is clear, well identified, solution well identified. where I have, would I say, I see challenges in most of the solutions are around the practicality of it. The use case of a typical user, for instance. So it's always good to define the customers who you're trying to target with your product. That guides you on how to, navigate or deal with the technicalities, right? We know we have more of small scale farmers, but if you target large scale farmers, that's absolutely fine. So you just have to know, spell out the kind of farmers that you're really targeting. If it's small scale or large scale farmers, what's their literacy level and the likes of that. That would help in how you design and present your solution. So it's just good for us on the back end when we're listening to you that you're defining these are really the users we're targeting. You mustn't necessarily target all farmers, depending on how you're presenting your solution or scaling it further. So that disconnect is what I see across board for all of the or rather most of the presentations. Were struggling to connect with your direct target users and the practicality of the products. But everyone have good, clear case of the problem and solution. It's around the use case that you have to really go back and rethink and try to fix. Thank you.
All right. Ms. Manuela, any questions?
Hi, Favor. I think the only thing I have as my question is, I know that I'm not, this is AgriPod 2, right?
AgriPod 2, yes.
Yeah, so the brief that I have says WhatsApp first weather platform, but I think I missed the WhatsApp bit of it.
Okay.
So I think if they could, go back to that, maybe when they're answering my questions, like where is the WhatsApp bit of that? That would be helpful to see. Thank you.
Miss Anne, do you want to ask a question?
Okay, I just need to say something. Sometimes, Miss Emanuela, sometimes you write out like a brief, and then towards the middle of the work, and you're trying to do the work, and you don't notice that this is not going to work on WhatsApp. I'd rather change it. So I think that was where they came in from. They probably thought it was going to work on WhatsApp due to the time frame and other things, and they think that they were going to change it. Maybe that was what happened. So sometimes your project brief might be saying a different thing, and your finished product can actually be a different thing. Probably they didn't change it at the end. But my own question is, I have seen your application, I have walked through your application, but there was something I don't know, I'm always saying it for almost all the group. When I used your application, I didn't use Makwa, which was what you gave me. I used Kano State, which I know is quite very hot. And then when I predicted it, it was telling me rainfall data for rice in March. And I refuse to agree on that because rainfall in Kano State is mostly between August. Severe rainfall is August. So are you trying to tell me that this your data is trying to use irrigation? It's accounting for both irrigation, or we're talking about the normal rainfall? And then in temperature, it told me the maximum temperature it was going to give, I think, was 30 degrees, which is not the actual real world situation. So I think that you guys should work on the real world situation of almost everybody, the real world situation of all this application. In the real world, what happens? Okay, why is my data giving me so answer instead of the real world situation? What am I going to do differently? But apart from that, you guys are doing amazingly well. That's just what I have to say.
All right, so please, we can respond. It's still your time.
Okay, thank you very much, everyone. Yes, for the practicality, we actually we are working in phases, right? So we intended to use USSD and WhatsApp alongside this platform, but this is like the easiest right now to achieve. And that's why, since it's just MVP, but we are still working towards, doing the rest, especially USSD for farmers who do not have access to mobile phones or the internet. That's for that. Then also the WhatsApp force, yes, we intended to connect through anything. It is very feasible, but we didn't have the time to work on that because we have our hands full. But definitely that is the next thing after now. And I have to confess something to everyone. Collecting data from CDS takes a very long time, about 8 to 10 minutes, and I know that's not going to be feasible for this presentation. And for that reason, since we used Makwa data, right, I only uploaded the data that I used for Makwa. Since this is just MVP, we just want to show you how it works. But in the real sense, if we have like GPU or whatever speeds up the process, we'll be able to collect data from CDS and analyze it immediately and use. That is why, Annie, you saw the wrong data for where you are looking for. But the data that is currently here is only for Makwa. I said that already on the group chat. I told everyone about it, and I'm openly telling everybody now that this map does not really apply to the whole of Nigeria, just Makwa for now. Thank you.
It's a round of applause for AgriPort 2. Thank you so much. All right, so lastly, for today, we have SME Pod 2. Over to you, please.
Miriam, we can still see your screen. Do you want to stop sharing? I see myself. Thank you. Ifechi, where is SME Pod 2?
SME Pod 2, your time is counting. If you have, I've not received any complaint that you have many issues, so.
Good evening, everyone. I just scanned through and none of their members is on this call. I'll just try and reach out to Colette so they can represent their pod.
Ifechi, can I confirm with you on WhatsApp, please?
My favor. This is supposed to be the last solution, right?
Yes, please.
Okay, sorry, my network was interrupted at some point. Is there the SME Pod 2, they are not available to present
Charity said there's none of the team
on the call. Okay. We already know what that means. So we can just get feedback from the judges, general feedback. If Mr. Martins has any feedback as an observer, whatever we just want to say to them.
All right. Okay. Let's put a little modality to that. First of all, please again let's give a resounding applause. If you can even turn your mic on, and let me hear the sound of your hands. Please let's clap for them. Let's clap. Let's clap. Clap for yourself. Oh. Even you that presented, you can clap for yourself too. I want to hear more. Please make it louder. It's interesting. It's impressive.
Yeah.
You know, Mr. Martin said something, and I took that personally. He said, "If it's easy, go and build something now." That was a direct hit. I take that very personally because he knew I will not be able to build it. So it's fine. Maybe next gen data, I will become a student too, so that I'll be able to build stuff. You know, it's your friends. It's fine. All right. So thank you so much for for your very, very beautiful presentation. I'm familiar with some issues I was not familiar with before now, and it's really great. And it's so great to see some of our ninth students. Mr. Richard, finally good to see your face, and the others. So yeah, well done to everybody. So the next part of this meeting will go like this. We're going to take feedback from the tutors. They have 2 minutes each to give their feedback. They have been given 5 minutes collectively, but I'll make it 6 minutes since the last group is now around. So 2 minutes. The timer, also going to use the timer. And after that, we'll have comments from Mr. Martins, which also double as the closing. All right, so I will just give the announcement now because I will not come up again after now. All right, so this has been the showcase of our first cohort of generation data, the program between YOULEAD International and DataCamp. It has been a very insightful time. We've had fun. I'm actually a nice person, but we just have to be strict with time because when you get to where we hope you get to, I think they will be more strict with timing, and you have to be articulate in a short period of time to get what you want, especially if you are looking for money. All right, so thank you very much. It's been very good. You can even hear from the comment from our judges. You've done so well. Okay, I was going to say this when we started. The fact that you made it to this event means you are a winner. I was going to read something. I saw it. I think PG posted it. We had 1,000 applications, right? 100 persons were selected. We had 60 supervised learning sessions, 6 weeks of intense training, then another 2 weeks for your product development. We had 4 expert mentors, 4 courses, and now we have 6 solutions. Unfortunately, we can only account for 5. And then tomorrow on your graduation, they will find out who the overall winner is. But I want you to go home from this event as a winner, because from 1,000 persons, it came down to you and your team. So kudos to you. I'm also aware of those who shied away, who did not want to participate. That you participated in itself alone makes you a winner. So the winner for this competition, if you prefer, it will be announced tomorrow during the graduation ceremony. And I'm reliably informed. I have to ask again so that nobody will ask me for the money. I have to ask again. And I'm reliably informed that a grant of 1 million naira will be given to the winner. So the winner will be announced tomorrow during the graduation ceremony. Further details on this will follow. All right, so just be on the lookout for information and clarity in this regard. All right, so thank you again. Thank you so much for joining. So now we'll go over to the comments and feedback from tutors. Like I said, they have 2 minutes each. Tutors, please, let's stick to 2 minutes. We're supposed to leave here by 5:50, but we can do another, can make it 6 o'clock. So we have to keep to time. So Mr. Martins can have the remaining 4 minutes to close, and that will be the end of this meeting. So it's been nice. It's been £10 for the person who coded for HeatCast. Interesting. Okay, the giveaway is going on now. Whoever coded HeatCast, remember I was the one who set timer for you. So that's your £10. Also consider me, But congratulations, £10 for you. Let me give 30 seconds. Maybe something else will drop. Giveaway says giveaway. I think it's giveaway season now. Let's see what will happen. If you're laughing too much, do you want to give giveaway? Do giveaway now. Do small thing. I'm reading my chat. So any other giveaway? All right. So maybe tomorrow in the graduation we'll see a lot of giveaway. All right. Thank you so much. It's been nice hosting this and having fun with you. My name is Favor Osemige, and hope to see you again and again. Over to you, tutors. 2 minutes each. So just watch the time. I'll start with Miss Anne, then I'll take Emanuela and Mr. Gabriel. After Mr. Gabriel, the next voice you'll hear will be Mr. Martins, and that will be the end of this meeting. Thank you so much.
Okay, thank you very much. I have so much to say and I'll just be fast about it. So for AgriPort2, which is weather.io, I can't remember the person who presented, but I'm going to say you own your stage. You don't need to be anxious. You don't need to think about time. When you are presenting, you present it. Just don't freak out. Don't get as anxious or anything that is going to happen. I went through your codes. I had some reservation, which I'm going to drop in the group after here. Apart from that, you guys did amazingly well. All the pods did amazingly well. I was seeing HeatCast codes and I was like, this is what we want. You are okay. For the past almost 3 months, you're practicing something and I want you to replicate it in a project you have been doing. And that's what we want. Even though most of the groups, you guys that are frustrated your life, but those are things we want to see. We want you to see how you can replicate what you've learned, not bring in something alien for what you've been learning. Number two is that it doesn't stop here. This is just the beginning. I can assure you in the next 3 or 4 months, if you look at these codes you built today, you'll be like, is it me that built this rubbish? That's how growth works. You don't just stop here, you keep on building. You keep on getting better at it. And then if you are working in pharmaceutical data or anything that has to do with pharma and data, you can hit me up. I think we could do some collaborations on that. But apart from that, you guys did well. Q easy. I love your presentations. I love your but I think I will give you guys a recommendation. Instead of just doing only the practitioner part, you guys should put a patient interface that leads the patient connect with the practitioner. Something kind of like that so that it will be seamless. Both the patient has an app for himself. The practitioner also have an app for himself. Safe Heavens, I think I dropped recommendation. I say Safe Heavens, Safe Moms. I think I dropped recommendation. Please work on those recommendations. Just make it stellar. These are $1 million project. I think if you guys should do better, incorporate all the whole feedback. I think these are great ideas, great project. Thank you for working with me. I know that I could be very on and off at times, but thank you. Thank you in general.
All right, let me just jump right in. Thank you guys so much for the presentation. It was very enlightening across all the teams. I I hadn't worked with the teams before, but I've heard it again. A lot of work has gone into it, and it's quite impressive to see the solutions. And I echo what I think Martins of Favor had mentioned is that it's not easy to build anything at all, let alone have a minimum viable product to demo with such short notice and pull in data and even run some predictions around it. And just saying that it shouldn't end here. You have very great products, and the opportunity really is endless across the different levels. But what I would suggest is that we go back again and really define who our end users are, especially for most of the solutions that we have here. For SafeMom as well, and also for Q, I think the one with the patient's wait time, there's an opportunity there, honestly, especially because long queues in health facilities has been a major challenge, especially at the primary healthcare level. But let us also take into account the internet connectivity challenges that we have in Nigeria. A lot of your solutions, I don't see the offline, this offline first design, which is something that you need to take into account when you're designing for context like Nigeria, where our digital maturity level is still quite low, and even most of the African countries as well. So consider your literacy level, consider your internet capabilities across the system as well. So I think those are my major feedback and your use case. You can have multiple user interfaces, but really let it be clear as to who your primary user is and what is the benefit. So your user journey should be solid. Thank you very much.
Okay, thank you very much, everyone. All of the pods are amazing. Like I mentioned earlier, all of the problems you've identified are very, very valid. The solutions you're providing are valid. The context where you now need to frame would be the target customers. You can't target everyone. It's ideal that everyone cannot be your target customer. So when you say farmers, it's still broad. you need to now narrow down from the large scales, medium scale, or small scale. You need to be very specific who you're trying to target. You can actually target multiple people, but you have to start from one, and it has to really be very specific. The customer you're targeting determines how you present your solution, contributing to what Emanuela said, whether it's going to be offline, use of internet, mobile phone. So that determines a whole lot in trying to do the case study, or rather the reality, what it feels like. But it's really amazing what everyone have been able to produce within the past 8 weeks. I know the level of commitment and dedication you need to put into taking a course online to utilizing it. So that's really very, very exciting and commendable to see from everyone, the efforts you put in, the teamwork you've put in, having to take your learning from just code to making it practical. And I think if you keep practicing and even utilize this can be a foundation for you to build something great with your team, going forward. So really amazing work, and I commend everyone. Thank you.
This is the part where I would have played music, but apparently, thank you all so much. Two things. First, Ifechi, is there any other activity after now?
Okay. Hi, everybody. Thank you all for being here. Thank you. Thank you to our amazing judges. You guys are super, super amazing. Thank you for showing up and doing very well. The major announcement, I think Favor has already said, tomorrow we would have a graduation ceremony. And aside announcing the winners, right, or the winner from this showcase event, we would also be announcing some people who will be receiving awards for their outstanding performance in the program. So it's very, very important that if you have anybody who was part of this program who is not here, who you know should be there, it's going to be fun. We're just going to have fun. We're going to discuss, and then we would have announcement of winners, awards, and of course we would get our certificates probably by Monday. Thank you.
All right, thank you very much, Ifechi, and to the rest of the team. I want to say it has taken a lot of work to get us here. So I just want to first appreciate the entire Generation Data team. I think on the call, I see Praise God, I see Charity, I see Favor, I see Miracle. Of course, Gabriel is part of that team, and a number of other people who have had to join calls overnight, ensure that you do your morning calls, your night calls every day. Guys, well done. Thank you, Fichi. Thank you, everyone, for putting that together. Of course, I knew that people would drop out, as always. From 100 people, we've dropped to a really significant number, right? And even further, the solutions further drop down, given to a significant number. But I just want to say the reason we did generation data in the first place is because we wanted a generation. Like you see, generation, like a group of people. We wanted a generation of people, right, who took data, they built the skills required around data, and then they took those skills, solved problems, and did something. Because you see, in the next 3 years, right, globally in the next 3 years, those who are creating content, right, will create content about those who built. Right? Those who are leading podcasts will speak about those who built, not those who stood on the sidelines. Right? Those who had things to write will write about those who built, not about those who spoke. So you see, the difference here is at age 0, you learn to walk, you learn to talk, and in the process, you fell, you got up, but you built. Right? So that's the most important part of this program. So there are 3 categories. Category 1, every one of you are winners. You still get to hear about the support and resources that you receive. Category 2, that they said that the person would receive ₦1 million. That's prize winner for the persons whose solution is whatever. So that's prize winner, but each of you are winners, right? And then the awards that come after that, that's also there. Right? We are making a clear commitment to this. And because Generation Data is a program I'm very personally committed to, I am telling you that you're rest assured that we will do all that we can to ensure that proper recommendations, proper suggestions are given to each of the solutions. I'm going to go over all the comments again, and then we're going to give you actionable feedback that you can take and put to move your work forward, really. And some of you might need to tighten up your multi-criteria analysis for how you're pulling things into the crops, into the whatever. But that's a conversation for another time. But so yeah, closing on this note. Yeah, closing on this note. Thank you, everyone. I'm going to try and call names. There are some of you I've never met, and some of you I have not even spoken to once, right? But you're here on the call. So, Favor Semige, thank you so much. Ifechi Compliment, thank you. Abdulaziz Alani, thank you. Adeze, thank you. Adeboyiga Miriam, fantastic presentation. Well done. All of us do not know Asan, but you know Asan, right? Amefule Winner, well done. I saw Excel on the call earlier. Yeah, fantastic. I saw that you had to bring your brother into the call. That was interesting. Maybe next time I'll bring my mom. Anyway, just joking. Hani, well done, fantastic, and you've been with these guys. Appreciate it. Awal, Mohammed, Sani, great job from your team. Great job, really, great job. But you still have a lot of work to do in refining what you have, right? I tell people that it's not the solutions that look good that would win eventually. It's the solutions that got feedback improved. Becky Ahibe, I don't know what you look like, but fantastic, great job. I don't even know what team you're on. I don't think you indicated. Charity, okay, Charity, Emmanuel, of course. Thank you, Charity, and the rest of the team. Chukuma, Chukunendum, right? Maybe after this call, I'll give you another thumbs up for SafeMoms work. You guys are doing great. Well done with the SafeMoms. Emanuela, thank you for the feedback that you've been giving. Very useful, actionable, fantastic feedback, and also for making it here as a judge. And we appreciate everything that you said. And Favor, Potri, well done, great job. These people can actually hear me. So while I'm saying all of this, so start preparing to turn on your cameras because I do want a photo to remember today, right? Just for my archives. Gabriel Onyeboli said, well done, great job. Thank you to the team. You guys have been fantastic. And also your feedback was great. I saw you giving like, oh, the end user, who are your end users? Lovely, lovely feedback. Gabriel Toluwani and Gloria Christopher, thank you. Kum Eva. Mercy, Gifter, Gabriel, Miracle, Doris Yagbon, Wongeras, Kananos in Franza. Thank you very much. Great to see you here on the call. That you're not the iPhone user. I would have arrested you. Praise God, America, of course. Thank you. Serena Health, TB Robot. Thank you. Xiaomi, is that a person? Well, whoever is behind Xiaomi, well done. Great work. Great work. Zubaida Mohammed, great job. Daniela Ayang, great job. So this is the part where you all turn on your cameras. For those who find it okay to turn on their cameras, so we can take a screenshot. And back today, the 31st of January. So we've officially come to the end of generation data. And I am, no, not generation data, the first cohort of generation data. I'm super proud that you guys are leading the pack. Great job. I didn't mention Richard. Well done, Richard. Great job. I don't know if there's anyone else I've missed out on their names. I see some photos are on, some videos are on already. So I'm going to count to 10 and I'm going to take a screenshot. Yes. Okay. 1, 2. Chukunendum, hi. It's the way Adeze is paused on the street for me. Adeze is paused. She's standing outside. She's paused. She's like waiting. Take the screenshot. Take the screenshot. Oh, can she's like, what's going on here? I can't find Richard. I can't find Kanano. Becky's like wondering when will you take the photo, right? Please, let's look and go home. All right. About to take it now. Yes. Manuela is serious. This did you go to do makeup for this event? Okay, the judging. Okay, well done. All right, great. You look fantastic. Who else? Charity, why can't I see you now? I can't see some people. Let me see if I can change my view.
I would have loved to turn on my camera, but no, I'm very strong. Yeah. So.
Okay, all right, that's fine. That's all right. Okay. Let me try to hide non-video participants. All right, so I have video participants. 1, 2, 3. Gen data. Everyone, gen data. Gen data. Gen data. Thank you. One more. 1, 2, 3. Gen data. It's Miriam's for me. Is he? Is he? Okay, let me now take people's profile photos, because apparently people want me to take photos of your profile photos. You see, you didn't turn on your camera as well. So for your graduation tomorrow, wear your makeup, dress up, cut your hair for your graduation tomorrow. And those of you who are going to write stories on LinkedIn, son, go and write stories on LinkedIn. I want to see stories. Like, we all know Hassan. He had a farm and lost $2,000. Write it. Right? We do not know what Sani lost when he was doing pod one, but yeah. All right. Thank you all so much. Enjoy the rest of your night. Good night, everyone. See you tomorrow. I don't know if the time for the graduation has been announced, but I trust it will be dropped on the WhatsApp group, right? Ifechi, do you want to announce that? Abi, praise God, do you want to announce that if it's something you have information for?
So the time for the graduation is 4 p.m. West African time.
4 p.m. West African time. Great.
Yeah.
Good night, everyone. Bye-bye.